Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
So, Dr. Ferrer, if you haven't heard or met him, you are in for a big treat. First of all, if you go to the December issue of Boomer Times, you will see the book of the month, which is written by Dr. Let's see, I'm just looking this quickly, Gustavo Ferrer, and the book of the month is called Cough Cures, and it is a brilliant book. And now we're so fortunate because Dr. Ferrer is on the phone calling in to tell us what's going on with he's a pulmonologist, and that's a very special thing, especially nowadays with the kind of weather that comes in and out, and you think you're sick, but you're probably not. You just have some sort of pulmonary disease. So good morning, Dr. Ferrer.
Good morning. Thank you for having me.
Yeah, it's a pleasure. And, you know, the article in the December issue, 10 Top Tips for Avoiding Heartburn, they were pretty good.
Yes, thank you. Thank you. Absolutely. This is the season. Too many things come around December. We are having the first wave of viral infection, the flu, and by the same token, we're celebrating, we're eating, so there's a lot of things that could happen. And some of those is going to be respiratory issues, heartburn, and that's what we're trying to highlight there.
So I have a question. As one ages, is there more respiratory disease than when you're young, or it doesn't matter?
The true answer to that is it may increase the chances of having more respiratory problems, but the reason that happens is primarily because we're having chronic conditions, diabetes, hypertension, some of the others that they are not well controlled, and they tend to lower the defenses.
I see, but you know, in your book, and what I love so much about your book, it is so filled with natural cures. It's like we used to call these the old wives' tales, but they're really true, aren't they?
They are true. They are true. You know, what we did in Cough Cures is that we went back and looked into all the remedies that multiple traditions have used for centuries. We look into the research that they have to back up the value, and we put in there all the top remedies with the research to back up their use and their value. Many of them have been used by cultures, different cultures, for centuries and centuries. So we found the adequate value research that increases their value to be used. And we also talk in the book about remedies and over-the-counters that people should not use, because the research also shows that they tend to have significant side effects, and others don't even have significant value for what we use them.
Well, let's go back to the avoiding heartburn. So when people come in to you as a pulmonologist, do they complain about heartburn, or they just can't breathe easily? Or tell us what your patients say to you.
That's an excellent question. I'm a pulmonologist, and I treat patients with chronic cough. I have a cough center. So most of my patients, they have this hacking cough, the tickle in the back of the throat, and some of them, they have shortness of breath associated with the cough. One of the top 5 reasons for chronic cough in non-smokers is actually acid reflux. And there's something called non-acid reflux. So even we have reflux coming out from the stomach into the food pipe without significant amount of acid. So those two can give you irritations of the reflexes of the cough, and people start coughing and so on. So when patients come to me, they don't even mention acid reflux. I'm a pulmonologist, but we are the one that we are going after that. We want to try to explore and find out, because it's so common as we get older, the esophagus, the food pipe, and the connection with the stomach develop multiple diseases. We can have hernia. We can have something called Barrett esophagus, which is an irritation of the distal part by the acid in there. So all these conditions tend to open and relax the little sphincter, the little circular annular contraction, muscular contraction, structure in the distal part of the food pipe, and it remains relaxed most of the time. So what happens is acids tend to bathe the food pipe, and this is the acid that sometimes comes up all the way to the throat, but most of the time does not. So this is what most of my patients do not realize, that even when you're not feeling that you have acid reflux, you may have it.
You know, that's a very interesting explanation, but I have another question. It seems that as one ages, I notice they're eating and they cough while they're eating. Are they eating too quickly? What is causing that?
That's another excellent observation. Two things could be that we're eating too fast, but let's go and begin slow down with the explanation. Our metabolism tend to go down as we age, so by far we tend to maintain the same amount of food that we eat, and we tend to consume high amount of carbohydrates and high amount of food that requires a lot of processing. And those carbohydrates need to be break down primarily initially in the mouth. So they require that we chew them for a little longer amount of time. And we don't do that. We tend to just chew. We're living in a time in history that we're running so fast that we don't even have time to enjoy a bite. So we tend to chew them too quickly, and then they go partially processed down to the food pipe, and that is when we start having the initial issues there. Second, the muscles that are around the mouth and around the throat involved in this process of chewing, they become discordant sometimes, but primarily could be triggered by this issue that we're putting way too much food, that we're chewing too fast, and then when we're trying to swallow that, the process is not natural, and that's when people start coughing when they're eating. And there are other people that have chronic conditions like Parkinson, there's other neurological problems that damage the muscles and the nerves that they're involved in the swallowing and chewing process. And what happens is that we continue to do the same thing, eating fast, and the coordination is not there, and then the food tend to go to the windpipe, and that's when people start coughing.
Wow, that's pretty good. So my guest is Dr. Gustavo Ferrer. He's the author of Cough Cures, The Complete Guide to the Best Over-the-Counter Drugs and Natural Remedies for Acute and Chronic Coughs. He is a distinguished pulmonologist, founder of the Cleveland Clinic's Cough Clinic. Let me tell you something else about him. He's also the founder of ICE, which stands for Intensive Care Experts. So if you'd like an appointment to see the physicians, call 954-482-4747. That's 954-482-4747, or on the net at icehealth.net. Now, let me just tell you, we're very lucky to have Dr. Ferrer because he now has other pulmonologists working with him. And this is a very important institute that he has because a lot of people have certain disease. They walk around with this little cough. They're always coughing. And when you tell them, oh, well, that's sinus. Well, maybe it isn't sinus. Please go see Dr. Ferrer. So, Dr. Ferrer, let's continue with this. Now, you know, you have talked about people with this nasal drip, and you have told them about using, I guess it's called X-Clear or xylitol. And I have now given this information to some of my friends, and it has cleared up what they said was a sinus condition.
That's an excellent question as well. We use regularly for people with postnasal drip, which is another issue that tends to be very common during this time of the year when we're having runny nose, that it could be related, as you mentioned earlier, to changes in weather, to the cold temperature, and we start having runny nose and stuffy nose. Those mucus, even without any viral infection or bacteria, they tend to accumulate in the nasal passages, create plugs in the nasal passage, and we tend to blow them really, really hard. We damage the mucosa, the tissue lining the nose passages, and then a viral infection or a bacteria comes in, and this is when we start having chronic inflammation and issues in there. Traditionally, people use over-the-counter for those periods that they have a little bit of nasal obstruction, and traditionally we have recommended saline, salty water. But in recent years, there is a nasal spray, which is a natural nasal spray that combines saline, salty water, combined with a natural product called xylitol. this nasal spray tend to clear up the nasal passages very, very well. Also trying to remove these plugs of mucus that we have in the nose, because it prevents the adherence, the stickiness of the bacteria to one another, and that's another value of this nasal spray. And by doing so, in the long run, prevents infections. We don't have a lot of research to back that part, but we do know that most people with chronic rhinosinusitis, that rhinosinusitis problem, and acute issues that they're using this nasal spray today, they find it extremely valuable. I recommend it. My patients with chronic obstructive pulmonary disease, something called COPD, they usually have runny nose, stuffy nose. My patient with sleep apnea, that they sleep with a mask and they are having stuffy nose and runny nose produced by the mask, they find it extremely valuable. My patients with chronic cough, because the number one reason for chronic cough in non-smoker still post-nasal drip. So we recommend the use of this nasal spray, and they find it extremely, extremely valuable.
So, Dr. Ferrer, you cover the waterfront, as I say, that someone comes in with a cough and maybe it's something even more serious. Let's talk about the lungs. When people come to you and they're having trouble breathing, what could it be?
Trouble breathing, shortness of breath, it could be either the tubes that takes the air all the way to the distal part of the lung, the so-called bronchi or windpipes, that produce an inflammation. The most common ones are the ones related to smoking, and those get worse as we get older and as we smoke more, and that is the chronic bronchitis or COPD. The second group that tends to be more common in younger people but tend to get worse when we are older is asthma. Those are by far the biggest group that people get with shortness of breath. Then we have shortness of breath that is isolated shortness of breath without any other symptoms. We looked into issues of combination heart-lung problems, and we have in that category something called pulmonary embolism, which are blood clots that can go into the lungs that tend to be more common as we get older. And there is also the combination of that clots with other conditions. There are people having scar tissues in the lungs, people having high blood pressures in the lungs, something called pulmonary hypertension, which is one of the most common reasons as we get older, and they're associated usually with connective tissues diseases like rheumatoid arthritis, lupus, and some of the others connected tissues, joints-related diseases. Then we have the group that produces shortness of breath that is associated with other symptoms like cough, phlegms, and mucus, and we're talking about pneumonia and acute infectious process of the lungs.
I'm always in such admiration of you, because I can ask you one question and you're like in the encyclopedia telling us about all this stuff. And, your background is amazing. You were Cuban born, and you have just, you struggled when you were in Cuba, and then you just were so determined to make a difference in the world of medicine, and you really have. It's such a pleasure to talk to you.
Thank you very much, Anita. Thank you for having me.
But I just want to say, though, that the whole thing with the breathing, it seems like when an elder person is in hospice, they always seem to die losing their breath. So I guess we are born, we have our first breath, and when we die, we have our last breath. But people are said that they die from, the word is what? From congestive heart failure. So is that something to do with the lungs?
Oh, well, absolutely. The lungs and the hearts we cannot separate, and congestive heart failure is when the heart is not capable of pumping all the blood out, and then that blood accumulates in the lungs. The fluids accumulates in the lungs and is what produces the massive shortness of breath. But usually that doesn't come isolated. Shortness of breath, congestive heart failure, most of the time is associated with other chronic conditions, and it tends to be worse in people that smoke. It tends to be worse in other conditions that are associated with the lungs. People that have clots in the lungs, people that have pneumonia, they push the heart to the edge and to the extremes, and that's when the heart failed, and that's when people develop congestive heart failure. We know that when that happens at that instance, is the most critical part. It becomes more kind of a what we call a multi-organ failure, because the heart is failing because it has been pushed to the edge by the pneumonia, and has been, then the kidneys follows, and then other organs follow. And that's the reason we encourage our patients, to seek medical attention early, to have regular follow-ups. We know today that chronic bronchitis, we know that congestive heart failure are, for the most part, are treatable. People respond very well to the treatment. It's just a matter of having regular, continued follow-ups with your doctors, that they're involved in understanding and knowing you.
Yeah, that's so true. And I think that people don't think about their lungs. They go to their beauty salon and they have their hair done, or they go and they get facials, but who really says, I can't breathe well, I'm going to go to a pulmonologist? I've never heard anyone say that to me.
Well, that is extremely important, and it's really true. You're absolutely right. We don't think in those terms, and the lungs is one of these organs, not because I'm a pulmonologist, I'm passionate for what I do. I'm passionate for what I do. The lungs is one of those organs, the only internal organ that is exposed to the ambient, is exposed to the outside ambient, and is also a big filter that is filtering everything that we breathe. But not only that, controlling and managing and getting to know breathing exercises and controlling your breath tend to release many toxins and tend to actually improve your attitude, your energy, and helps with depression. And all these spectrums is where breathing exercise fall. And this is, people linking meditation, yoga, many other practices into this. But in the end, it's just getting to know how you breathe, getting to know how to harvest the value of good breathing exercise. We tend to hold the breath way too much. We sit way too long. And all these impact the lungs. So the lungs is one of those organs that we definitely have to take care of, that we definitely have to be involved in them. The environment tends to touch us in the lungs very much, and many diseases tend to begin there. So you are absolutely right. This is something that has to be checked. It's something that has to be looked at. Most people go to the pulmonologist just at the tail end when they have really, really serious problems.
Yeah, I have to thank you also because I don't think this is part of a pulmonologist education. I think it's just you and where you grew up and what you think of. But you started me on these fantastic shakes in the morning. You changed me from milk to almond milk. You changed me. You did so many things for me, and I really love that. In fact, I'm almost craving that every morning to have. I do get flax seeds I put in, but I have frozen fruit. And I then put in my either spinach, or I make this drink that is so delicious, and it's making me just an amazing feeling so good in the morning.
Oh, thank you. Absolutely. This is another thing that I touch in my practice with my patients, and we discuss with them regularly, because what we eat, it also impacts our breathing and impacts everything. So my patients that come with acid reflux, we tend to explore what they eat, and we know that shakes and are excellent in the morning and wonderful as a breakfast. You can have all what you need in terms of nutrients, proteins, vitamins related to the good vegetable that we should eat in a day, put it all together in a shake. And by the same token, have digestions and easier digestion, and have actually less acid reflux. For my patients, usually I switch it over. Those that have a lot of secretions and those that have digestive issues, I switch it over to almond milk. The evidence, the research shows that tends to be far much better. I have told you the story of my younger daughter, that she has chronic dryness, stuffy nose, runny nose in her early teens, and we decided to switch her over a few years ago to almond milk, and that took away that secretion, and she has no more issues. We have used with her also the xylitol nasal spray, combining that just with a little switch in her diet to the almond milk has been phenomenal.
So the almond milk provides the same vitamin D that we need?
It does.
Because, no one told us about this. It was always, you're going to have milk, and then milk does clog people up, as you were saying too, and people that have pulmonary problems. But I like the almond milk, and I buy it very naturally. I don't put anything, they can sweeten it with something, and I don't do that. But I also add yogurt. I now bought my own yogurt machine. You have really, I ought to put a big plaque up in my house. Dr. Ferrer says this, but I make natural yogurt, and then of course I add the frozen, the bananas, and when you buy bananas and they go bad, they don't go bad. You put them in the freezer, right?
That's right. That's right. You put it in the freezer, and I put in the freezer also some of my vegetables, or I put spinach, and I put the kale in the freezer. Tend to last longer, and you can just pull it up, put a handful into the machine, and you have a wonderful shake.
Well, you just helped me this morning because I've been buying kale and spinach, and towards the bottom it always seems to be going soft. So I should put that into the freezer also?
Yes, absolutely, and it preserves all the nutrients. It's been very well documented. So I put it, as soon as I buy it, and I put it in the freezer. If I'm going to use it, for the whole week, and it lasts the whole time, and you can use all the way to the end. You're exactly right, because humidity is an enemy of all these vegetables when you put it in the fridge. After 3 or 4 days, you're going to have in the bottom of the box, you're going to have some of them that become sticky, and fermentation can get in, and those should not be used. But you put in the freezer, and there you can use them.
Yeah, and you said something that was so true. We buy beautiful blueberries and raspberries and strawberries, and within a few days, at least the strawberries go bad. But you always tell me, don't buy it that way. Go buy frozen. And I've been buying the frozen fruit, and it's incredible. It's never bad, and it also makes the drink very cold, which is so nice.
It is excellent. It is excellent to do it that way. You don't have to put ice. You don't have to put extra water. So it goes really well.
So I'm worried I'm becoming an addict for it. I think I could have it in the morning, then have it at night, not even eat regular food.
Well, you got to put something in between, but it's a wonderful thing to do.
Yeah, it really is. So let's get back into people, though, who have, let's say lung cancer. How does someone know when they come to you that they don't know they have lung cancer? How do you detect that?
Well, lung cancer, based on the history, the most common lung cancer is linked to smoking. So when I have a patient that have more than 20 years of smoking and is older than 50, we have to, it's quickly in the history becomes a red flag that I have to explore a little bit more. And then we look for symptoms. Some people come in early stage with no symptoms at all. They just have 20 plus years of smoking, and they went to the doctor for an annual exam, and they got a chest X-ray, and they saw something abnormal, and they send it to us. The process goes that we do a little bit more specific imaging test, which is the CT scan, the CAT scan, that we looked really at what is in there and how we are going to be able to address it based on the location. The final diagnosis is by reaching out to that, whether through the lungs, something called bronchoscopy, or from outside the lungs, that we're trying to get a biopsy of that tissue, and we make the diagnosis. Unfortunately, lung cancer is one of those that people really wait to the last minute. And it's not because people want. It's because we tend to believe that cough, it is something normal. And it's not. When you have transient cough, you cough when you've been exposed to really strong chemical, that is absolutely normal. But when you have cough that is persistent, that is lingering, that is sticky, that is associated with mucus sometimes, other times do not, other times associated with blood, all these are red flags. So chest pain that is persistent and shortness of breath, all these constellation of symptoms, we tend to wait too long because we believe are normal, part of aging, and they're not. So that's the reason most people tend to seek medical attention for lung cancer way too late. So we are going to encourage our patients, if you haven't coughed that it goes beyond 4 to 6 weeks, this is the time that you need to be checked. This is the time that a chest X-ray should be done, and an appropriate follow-up of all that should be included in the evaluation.
Well, thank you, Dr. Ferrer. Dr. Ferrer is the founder of ICE, which stands for Intensive Care Experts. For an appointment to see the ICE physicians, call 954-482-4747 or on the net at icehealth.net. Thank you so much. I really always enjoy talking to you, Dr. Ferrer. I'm going home now, and I'm going to go get my shake.
All right, me too.
Okay,
Have a wonderful weekend.
You
Thank
too.
you for having me.
Thank you, Dr. Ferrer. Bye.
Bye-bye.